All right, I'm going to get started. So I'm David Cates, and I'm a psychologist. I'm the director of behavioral health here at Nebraska Medicine. This is an opportunity for you all to hear a little bit about best practice and evidence-informed techniques for building resilience and stress management tools. If you have questions, feel free to ask. Just unmute and shout them out. That's absolutely fine. So I'm going to skip this. This is just some of the primary sources of information for what we're about to do. So the objectives are to understand what we mean by resilience, and then to actually help you to increase your resilience, and in particular, to learn some techniques for managing stress, for healthy thinking, for encouraging positive emotions, social support, and then we'll talk a little about sleep, diet, and exercise. These are all components of resilience. And then we'll also talk about when all the things we're talking about isn't enough, and when to ask for help. And in the course of this conversation, you'll be able to develop your own personal resilience roadmap. That's the handout that hopefully you have. And if you don't, you can go ahead and print it, run to the printer, and make your way back. So why are we talking about resilience at all? Well, we know that during a pandemic response, healthcare workers are at risk for emotional distress. And this is not a function of who becomes healthcare workers. It's really a function of the unique challenges of the role during a pandemic. So let's talk about what types of challenges increase risk for emotional distress. Well, challenges around proper use of PPE and infection control protocols. So there may be questions about what's the right way to use it, or whether there's actually adequate supply of PPE, or changes in protocols. We've had a few changes in both how we're donning and doffing over the years, but also now in how we're reusing and disinfecting the N95 respirators with ultraviolet light, for example. So those kinds of challenges cause stress. In some deployments, and I'm not sure in your cases, but in some deployments and activations, there's a lack of organization initially and some confusion about role clarity. One example might be up on the new unit on the 7th floor. That's sort of a combination unit. It had staff from the biocontainment unit and leadership of that unit kind of merging with leadership of the 7th floor unit. And so there are opportunities certainly for difficulties with organization and role clarity, and those are challenges that increase stress. Changes in workflow and responsibility. So I remember talking with a few nurses when the word first came out that we're going to sort of take the biocontainment team and move them over into this larger unit and integrate. And there was a lot of worry about what that's going to be like and changing with team membership. And so when we change our workflows and we change people's responsibilities, that creates stress. Concerns that I just touched on before, limited resources and supplies. I'm sure everybody in this webinar here has been listening to the news about concerns about access to ventilators and N95 respirators and gowns. So those, even if you're not short right now, those create stress hearing about those. And certainly when institutions are running low and worried, they have 3 days on hand, wondering where they're going to get it from after that, that creates challenges and stress. Altered standards of care. So you might have heard the expression crisis standards of care. So sometimes we alter our standards of care because we have an influx of patients to manage a higher number of cases. And those often create ethical challenges, like who should get a ventilator if it came to that. Right now we have sufficient numbers, but there could come a time with a surge in critical patients that we don't have enough. And that's a situation in which we make decisions about who gets one and who doesn't. And those are enormously stressful and sometimes traumatic for healthcare workers. And of course, they create ethical challenges. In some cases, there may be separation from usual colleagues as we deploy staff in different ways. You're hearing about this flex PTO model now. We have people in some of the surgical and procedural areas where we're decreasing volume, and they may be redeployed to other areas and separated from usual colleagues. that may happen to you. The biocontainment team, that team itself is usually deployed elsewhere, then they come together. That's a source of stress. Witnessing the death of patients, which if this gets worse, is certainly something that if you haven't experienced, you certainly could. And that obviously is enormously stressful. And we know from the literature, particularly if it's pediatric patients, there may be challenging team dynamics. So working with different people under stress, there may be some people you get along with better than others, having different bosses, different people who are than your normal work when you're not working in a pandemic mode. And that's a source of stress. By the way, please mute, unless you have a question, go ahead and mute your microphone. I think somebody's unmuted at this point. You may have fear of contracting the illness. That's normal. We expect people to have that fear. And then related to that, concerns for the safety of your family and friends. What if I don't have symptoms, but I bring it home? Those are all challenges in a pandemic response. Sometimes people in your life may challenge, why are you even doing this work? Can't you just call in sick, or can't you take a leave or do something else? You're a nurse, you could work anywhere. So sometimes there's pressure to justify your work commitment to people in your own family. And then when we decommission, when the pandemic is over and people go back to their normal flow, sometimes that itself is stressful. Transitions are stressful for people, even if they're desirable. So going back to regular units if you've been deployed on a different unit. Some cases there's stigma, lack of appreciation. I know from working with the biocontainment team over the past month, there have been people whose spouses were asked not to come to work before all of the social distancing because they were concerned that because their spouse worked in the quarantine unit, that the partner would bring the virus to work. We've had situations where people are disinvited from gatherings. Again, right now, people shouldn't be having gatherings if we're following the 10-person rule, but you've had situations like that where there's some stigma about the fact that you work with infectious diseases. Fatigue and limited rest time. Folks in leadership positions, I think, are particularly vulnerable here. I know that many people are working 7 days a week. For at least the past month, there's been no actual break in the workload. And maybe some of you as well are working unusual hours and having limited rest time. I know when there's desired expertise, like in the biocontainment team, for example, people are working extra shifts because they know that they're needed. And some of you in critical care and ultimately palliative care as well, those things could happen. And also personal and team pressure to succeed. We are Nebraska Medicine, right? We're the world leader. We're the ones teaching other institutions how to do this kind of work. And so there's enormous pressure that people may feel personally and as part of the team to be successful. And finally, the last challenge I'll mention here is self-doubt. And you would not be human if you didn't have some doubts at times. Am I doing it right? Am I up to the task? So why did I take all of this time to go over these challenges? To make sure that you are thinking about these, because even if you haven't experienced them yet, when we talk about being resilient, one of the keys is identifying in advance what it is that we're walking into, what we're going to face, and then having a plan for how we're going to manage that. So we're going to come back to that concept in just a minute. Questions? Okay, well, let me proceed, and then again, we'll have a chance for questions. We know that the more of those challenges that I just listed, the greater the distress. And this is based on research that precedes the Ebola outbreak, but also in terms of SARS, but also in Ebola, a lot of research on what causes stress in healthcare workers, and that's where that list actually came from. We know that most healthcare workers are resilient and will not experience lasting distress. So that is the good news. But we also know from research on folks who deploy in disaster areas, and also from people who deployed to work in West Africa during the Ebola outbreak, we know that depending on the stresses during the response, 10 to 20% of healthcare workers are at risk for some distress or a new disorder that they didn't have before the event. And that includes things like some post-traumatic stress, insomnia, alcohol or drug misuse, depression, and anxiety. So it's a minority of healthcare workers and first responders who actually have lasting distress that might qualify for one of these psychiatric categories. but we know that it's a risk. And again, the greater number of those stressors that we just talked about, the greater the risk. Also, you should keep in mind that symptoms can occur after the outbreak is under control. Now, this is a little different. This is going to be protracted, or it's been protracted, but in many deployments, people do fine during their response phase. And when things calm down afterwards, they start to notice feeling, keyed up or anxious, or they're having sort of lots of intrusive thoughts about what they just went through. So be kind to yourselves, and if that happens, just recognize it for what it is, and we'll talk about what to do and where to get help. Symptoms do decrease over time in most cases, so that's good news. But sometimes we do see relapse, particularly if there are pre-existing mental health conditions. So if you're sort of starting out, with the baseline, and we know that, 20% of the population has, a mood disorder, and a similar percent has anxiety disorder. So, it's all of us, right? So if you have a pre-existing mental health condition, then you're more likely to experience a relapse. And re-exposure to additional infectious disease outbreaks can also cause relapse. So when I'm talking about relapse, sort of, you might have some distress, then you might feel better, but those feelings could come back. If you have a history of pre-existing conditions, you're more likely. And again, if there's a relapse, if we have another community outbreak, we certainly hope not. But those are things just to keep in mind. So what in particular do I want to point out here about risk factors for psychological distress? 4 things I'll just point out. One is, if you have a perception that you're at heightened risk of infection, that increases your risk for psychological distress. A longer duration of high-risk exposure increases risk. As I just mentioned, a previous history of psychiatric illness and a lack of social support. And you'll hear me talk about social support at least 2 other times during our brief time together today, because it is so critical to surviving and thriving in challenging times. So what helps to prevent psychological distress? Well, comprehensive preparedness. The more prepared we are, the more likely we are to thrive and survive through these difficult times. And that includes the technical training that you have. So, the training around donning and doffing PPE is technical training, and the more prepared you are, the more you practice it, the more confident you're going to feel, the less you're going to feel like you are at risk for those exposures like we just talked about. But that also includes resilience training, and that is what we are talking about today. So I'm glad to have the opportunity to speak with you about it, because comprehensive preparedness is not just the technical skills, but it's the things that we're talking about now. So what do we mean by resilience? Resilience is the ability to adapt to or to bounce back from challenging life situations. And there are several key components of resilience that we'll talk about today. One is simply knowing when you're stressed and how to manage that stress. Another is what we call healthy thinking. And a big part of that is being aware of cognitive distortions. So sometimes we have distorted thoughts that actually make us more stressed. They amp up our central nervous system. And they're not accurate thoughts, but they're kind of reflexes that we have, and we all do them. So we'll talk about a few of those to watch out for. Another element of resilience is focusing on positive emotions and experiences. We know from research that people who come through difficult experiences, and there's a lot of work with combat veterans, for example, and they research, who comes through and doesn't have post-traumatic stress and seems to be thriving and doing fine, versus who are the people who have trouble. And some of the characteristics of those more resilient veterans are their tendency to just focus on more positive emotions and experiences. In the course of any given day, there's some good things that happen and bad things that happen. And those who tend to focus more on the positive things tend to do better at the end of the day. Fourth is, as I referenced before, social support. So we'll talk about that. And finally, healthful sleep, eating, and exercise habits are also critical to your resilience. You want to take good care of yourself physically. Now, the handout that I referenced before is the resilience roadmap. So we're going to start asking you to populate that resilience roadmap. So by the end of our time, you'll have this individualized kind of plan for how you're going to handle stressors that you encounter on the job. So first and foremost, and you remember we talked about the 5 elements of resilience, is knowing when you're stressed. So it helps to know what are your personal signs of stress. We all have them, right? They're different, they're unique to us. So I'll go over 4 categories of types of personal stress signs, and your job is to say which ones apply to you, and then on that handout, circle them. And if there's something that is not written that to circle, there's a line to write other. So go ahead and put what applies to you under the other line. So physical symptoms, right? Some people get back pain, muscle tension. Some people, in their jaw tense up, or their shoulders. Sometimes it's stomach upset or headaches, changes in appetite, difficulty sleeping, getting fatigued. So what are your personal signs of stress that are physical? We also all have our emotional signs. So some of us tend to gravitate to worrying. Others become irritable. Some people get sad and down. Others become more angry, could be fear. Some people feel guilt more commonly than others, mood swings, hopelessness. So think about, what are your emotional signs of stress? What are your sort of go-to emotions when you get stressed? And then cognitive. Some of us have cognitive signs of stress, like difficulty concentrating, or trouble remembering things, or feeling confused, or catastrophizing, which we'll talk about under healthy thinking in a moment. So again, think about you. Do any of these apply to you? And if they do, go ahead and circle them on your resilience roadmap. And then finally, behavioral signs of stress. So some people tend to snap at others more readily when they're stressed. Some of us just keep working. We just bury ourselves in our work when we get stressed. Some people become impulsive. Some withdraw and sort of isolate from others. They become, less communicative. There may be poor self-care, increasing use of drugs or alcohol, and increased conflicts with others. So go ahead and just take a moment, look at your roadmap, and circle the items that apply to you, or write them in under the other line if they're not listed. I'll give you just like 10 seconds or 20 seconds to do that, and I'll be quiet here for a second. Okay, so hopefully you've identified your personal signs of stress. Now, what I'd like you to do, and this is the list we had up before, I'm not going to go back through them. I'd like you to take a minute. These are listed on your resilience roadmap, and identify what you think is going to be hardest for you to deal with. So you all know, and many of these items you may already be dealing with. Some you may not be dealing with yet, like altered standards of care, but you ought to think about how hard would that be for you if you're treating patients and you have more patients who need a ventilator than we have ventilators, and we're going to let some people go, let some people die because we have to decide which patient gets the ventilator. Right? Those are crisis standards of care, and that kind of expectant triage decision is enormously stressful. So think about this list. Is it worries about your family? Is it the self-doubt that you might experience? So again, I'll give you like 10 seconds. I'll be quiet, and I'd like you to circle and identify what you think is going to be most difficult for you. Whoops, I was using Epic right before. Here we go. For you to manage in a pandemic. All right, hopefully you've identified. So now you've kind of thought through a little bit about what's likely to stress you out the most. And then you've also thought about, how do I know when I'm under stress? What do I do? What's my body like? What do I think? How do I think when I'm under stress? And now we'll talk about planning how you will relieve stress during the response. Now, everybody already has some techniques that work for you. So you'll notice I say what positive techniques already work. Some of us have negative techniques, right? Like using drugs or alcohol when we're under stress, or overworking. So those may work in the moment, but they tend to have longer term negative consequences. So take a look at this list and think about what positive techniques already work for you. And if you have something that's not already on this list, go ahead and write it in under other. But this is really important because, and it sounds silly, but when you're really stressed, you just simply may not think to do these things because of the amount of stress you're under. Remember, some people have cognitive symptoms where they kind of narrow their focus. It becomes hard to concentrate. They can't think beyond what's in front of them. So you want to identify it now so you're prepared and say, yeah, I really, journaling works well for me. Or I love to listen to music. I like to get outdoors. So think about how you relieve stress now, what works for you, and go ahead and circle them or write them in. Oops. And now I just want to suggest a few additional tips. If you don't already do these things, you might want to circle the ones that kind of resonate with you on your resilience roadmap. One, quite simply, just taking frequent short breaks. And sometimes when you're on a shift, that just means just taking a deep breath for a second, and just sort of gathering yourself, or getting away for one moment and looking at something on your phone, or sending a quick text to somebody, checking in. Just a frequent, just a short little mini break. Another tip that I strongly advise is to limit your media consumption. I know I experience this. I've been working many, many hours a day ever since the folks from the Diamond Princess got here, and then I go home and my wife's got television on with all this news, and it just becomes overwhelming. It's like my head is swimming with coronavirus, and so I'll ask her, can we just turn that off? And what I prefer to do is just get my news like twice. Once in the morning, I have a little morning news podcast. I listen to a little one in the evening, and that's it. But having it on in the background, those blaring headlines, that can really amp up your central nervous system, right? That can really get you going, and literally cause physical stress because you're hearing these messages constantly. The shortage of PPE, what's going on in New York, what's going on in Seattle. So I strongly advise limiting media consumption. We'll talk about a gratitude journal in just a minute. It's a great technique. And just spending some time outdoors. Sometimes you almost forget there is an outdoors. We get so stressed, and just getting some fresh air can be enormously helpful. Another tip is remembering why you got into this work in the first place. Sometimes in the thick of it, we get sort of narrowly focused on our tasks of the day, and we forget sort of the mission-driven selves that we are in healthcare, about why we're in this work. And that can help relieve some stress to remember, you're doing something meaningful and vital, and why you got into this work in the first place. In addition, I would recommend strongly that in addition to these relaxing things and positive techniques, that everybody develop and learn some formal relaxation techniques. So I've listed 4 here. These are techniques that you actually have to practice and get good at to be able to use when you need to use them in a stressful situation. So deep breathing, a body scan, mindfulness, and visualization. So what I'd like to do next is actually, note the techniques you will use on your resilience roadmap. So anything in terms of formal techniques you may already use, or those additional tips, go ahead and note them. But I'm going to do a little teaching now about 2 techniques. And I imagine most people are just sitting in front of a computer somewhere. I don't know if you're in a room together, but let me teach you how to do this. And I'd strongly encourage you to practice with me. So the first is deep breathing. And so the basic technique that I like to teach is we inhale through the nose for 3 seconds, pause for 2 seconds, and then we exhale through the mouth for 4 seconds. Now, you want to fill the bottom of your lungs. Let me ask a question. Can you see me? Is there a little image of me, or is the screen completely taken up with the slides?
I can see you in the corner of my screen, David.
Okay, that's good to know. I'm going to see if I can get my torso in here. All right, I'm going to turn sideways. So can you see like my torso here?
Yep, that's perfect.
All right, okay. So here's a little technique to make sure you're doing it right. So the idea is you want to fill the bottom part of your lungs. When you do that, it pushes out your stomach. People sometimes say, I'm putting air in my stomach, which of course you're not. You're putting air in the bottom part of your lungs, and there's a muscle, the diaphragm over your stomach, that expands when you do that. When your diaphragm expands, it sends a signal to the rest of your body to relax. So you get a much more relaxed feeling with a deep breath that goes to the bottom part of your lungs. So the 2-hand test is if you put one hand up here on your chest, the other on your stomach, if you're doing it right, the hand that moves is this hand. It's the bottom hand. Now, I don't know if the resolution is good enough, but I'll just demonstrate. So when I take a deep breath, I don't know if you can see, but this hand here is sort of moving. And then as I exhale, it goes back in. This hand is not moving at all. Okay? So when we do the deep breath, we want to put the air deep into the lungs. So let's give this a practice. I'm going to just do 3. I'm going to count you through it. So I'll pace through 3 deep breaths. So get comfortable. You might want to close your eyes. It helps to focus in. And let's do it now. So we'll go in through the nose, 2, 3, pause, 2, out through the mouth, 2, 3, 4. In through the nose, 2, 3, pause, 2, out through the mouth, 2, 3, 4. In through the nose, 2, 3, pause, 2, out through the mouth, 2, 3, 4. Okay, so that was 3 deep breaths. Now, if you haven't done that before, you may not feel anything, or you might. Sometimes people get a little dizzy or lightheaded with it. It takes practice, and it's very easy to practice this, but if you practice this, you'll get good at it, and 1 deep breath by itself can help to settle you and relax you. It's something you can do before you enter a patient's room, before you have a difficult conversation with somebody. So it's a very useful and portable tool for numerous situations. We'll have a chance to practice it again in just a second, but before I go on to the body scan technique, are there any questions about what we just did? No questions? Usually I ask for feedback. I don't know if anybody is brave enough to unmute and just share if that was helpful. Again, you have to practice it, but did anyone get any feeling of relaxation from that, or kind of have a sense of a change in your physiology? We know from research that when you practice it and use it, your blood pressure decreases, your heart rate decreases, your oxygen consumption decreases, your muscle tension decreases, and even cortisol secretion decreases. When cortisol is, is a byproduct of stress. So any feedback about how that went? Radio silence on the web-based, I only ever do this in person with people and with patients.
Hey, David, we got somebody texted in the chat box. They said, felt relaxed after breathing exercise.
Well, thank you for that, whoever did that. That's wonderful. I appreciate that. And so it really does work, but you do have to practice it, and then it'll work for you. I'm going to teach you another technique right now called the body scan. What I'm going to do is show you on here what we're going to do, and then we're going to do it. So click back in here. Okay, so what I'm going to do is ask you to get comfortable, and then ask you to close your eyes if you're willing to. And then we'll begin with 3 deep breaths, so we'll have a chance to practice what we just learned. And then I'll say just breathe naturally. And then the idea is going to be to release tension with each exhale. And we can even say, I breathe in relaxation on the inhale, I breathe out all tension on the exhale. And then we're going to go in sequence and relax different parts of the body, starting with the hands and work our way up to the forearms and shoulders, and then to the head, and then down through the rest of the body. Then when we're done, we'll briefly scan for any tension, and we'll kind of release that tension wherever we still feel it. We'll focus back on the breath, and then we'll come out of it. This is called the body scan, and it'll take a few minutes, but again, I'd strongly encourage you to practice it with me now, and then you can practice thereafter on your own. So if you would, just get comfortable. It helps to uncross your arms and legs. So just let them be supported by the chair or the floor. For most people, closing the eyes helps to elicit the relaxation response. So please go ahead and do that if you're willing to. And just start by noticing the weight of your body on the chair. Notice any pressure or heat. Notice the sensations of your feet touching the floor. And now let's do our 3 deep breaths using the technique that we just practiced, and then we'll launch into the body scan. And remember, when we do this, to put the air down deep into the lungs so it feels like you're filling up your belly. Okay, so let's go. Let's do, ready? In through the nose, 2, 3, pause, 2, out through the mouth, 2, 3, 4. In through the nose, 2, 3, pause, 2, out through the mouth, 2, 3, 4. In through the nose, 2, 3, pause, out through the mouth, 2, 3, 4. And now just let your breath be natural. So don't try to control your breathing anymore. And just take a few minutes to just notice your breath flowing in and out. Again, not trying to control it. Now, without trying to control your breathing, imagine tension and stress being released each time you exhale. And each time you inhale, you're taking in relaxation. So as you inhale, you can tell yourself, I breathe in relaxation. And as you exhale, I breathe out all tension. I breathe in relaxation. I breathe out all tension. And allow any physical tension to be released as you exhale. Now, in order to recognize tension in the body and to let it go, we're going to focus on one part of the body at a time. And we'll start with your hands. Now, just for this first part of the body, we're going to start by making a fist for 5 seconds. You know, just kind of wherever your hands are, on your lap or by your side, just go ahead and right now make a fist and squeeze it hard. Feel that tension. You might feel a little cramping in your fingers, a little painful. Now let your hands completely relax as they rest on the arm of your chair or in your lap. And notice the difference. Notice how they feel now. You may feel a little tingling, maybe a little pulsing sensation, maybe a feeling of warmth as the blood flows to the hands and the fingers, maybe a feeling of heaviness. Now we are not going to do any more tensing, okay? We'll just do the relaxing part. So focus now on your forearms and notice if there's any tension in your forearms. And as you exhale, just let that tension go. Let your forearms feel heavy and relaxed. Now bring your attention to your shoulders. Is there any tension there? Are they pulling up a little bit? So just let your shoulders drop. And as you exhale, release any tension in your shoulders and let them, in your entire arms and hands, just be heavy and relaxed. Now bring your attention to your neck. And as you exhale, release any tension. And now let your jaw relax. Let your teeth be slightly apart. Notice any warm or tingling sensations in your jaw as you let go of any tension there. And now let the muscles around your cheeks relax. And soften the muscles around your eyes. Just let your eyes be still and relaxed, whether they're open or closed. And now let the muscles in your forehead smooth out. And now just notice the top of your head, the back of your head, your scalp. Just notice them. Let them all feel still and relaxed. So your entire head, face, and neck are relaxed, maybe warm, maybe tingling, maybe a feeling of heaviness. And now bring your awareness to your stomach and your chest, letting go of any tension and allowing them to become more and more relaxed each time you exhale. Now focus on your back, letting go of any tension and allowing yourself to feel heavy and relaxed. And then move on to your hips and your buttocks, letting go of any tension and allowing the muscles there to relax and soften. Now focus on your thighs, letting go of all tension, letting them feel heavy and relaxed. Then your calves. Then focus on relaxing your feet. Bring your attention to your toes, letting your toes completely relax. Maybe feeling a tingling or warmth. And now just let your entire body feel heavy and calm. And scan your body for any remaining tension. And imagine sending your breath right there, like a laser, and letting that tension go as you exhale. Just focus on how relaxed and heavy you feel. And with each exhale, let go of tension and allow yourself to feel heavier and more relaxed. And when you have other thoughts, just let them pass by like clouds in a blue sky and bring your attention back to your breathing and relaxing. Just take a moment to notice this experience of relaxation. And remember, you can get back to this relaxed state anytime you want with just a few deep breaths and a quick body scan. Now I'm going to count backwards from 3 to 1 to bring us back to awareness of the room. So 3, notice the sounds in the room that you're in. 2, begin to just move, maybe wiggle your fingers and toes a little bit, feeling your body in the chair. 1, open your eyes, feeling awake and refreshed, but still maintaining that feeling of calm. Okay, now we'll look back at the screen and we'll continue on from here. And you can achieve, hopefully you're in a relaxed state having gone through that exercise. You can achieve this relaxed state in seconds, okay, if you practice the body scan. If you practice it when you're not stressed, then over time, you'll be able to achieve it without going through each body system separately. So I've been doing this for like 30 years. And what I can do now, because I've practiced it and I put in that time, I can do a deep breath, close my eyes, and quickly relax all those muscles at once and scan through my body for any tension. And as I exhale, just let it go. And I can steady myself and get that physical relaxation literally in seconds because I've practiced it. The analogy that I use is if you're playing basketball and you want to make a layup in a basketball game, you're going to first have to practice thousands of layups by yourself in the gym with nobody guarding you, right? If you want to make it in the game when people are guarding you, you'll first have to get good at it without being guarded. In the same way, you can't walk into a stressful environment and expect the body scan and deep breathing to relax you if you haven't practiced it. You got to practice it when it's calm, when it's quiet, when you're not on duty. And if you get good at it, then you bring it to work and it's right there for you to steady. Questions or comments about the body scan? Anybody want to share if they felt relaxed? This time I'll know to look at the chat area if anybody wants to put in a comment. Okay, I don't see them, but I may be missing it, but we're going to continue. So there are some web resources to help reinforce this. Here's a couple of websites for deep breathing, a couple for the body scan. These are included on the resilience roadmap that we handed out. And there are a couple apps that I'll mention that are great for both deep breathing and the body scan, but other techniques as well. So one is called PTSD Coach. The little icon looks like this. There's a section called Manage Symptoms, and then under that, Tools. And it's wonderful. It's loaded with exercises for deep breathing, for guided imagery when it takes you through like a picture of a mountain scene or a forest area or a beach scene. There's muscle relaxation, mindfulness. There's even some tips for sleep. And by the way, it's called PTSD Coach, but anybody can use it. It's not just for PTSD. These tools are universal tools. And then another app that's free is called Mindfulness Coach. And so we're not talking about mindfulness today, but it's very much like the Be Here Now, a technique that you've learned as part of culture training. But this is an app that teaches mindfulness. It's got a variety of exercises in it. They were both developed by the Veterans Administration and the Department of Defense, and they're free for anybody to download. So I encourage you to experiment with those. You may want to circle that on your resilience roadmap if it's something you want to consider in the future. All right, so let's move on. A couple other topics before we wrap up. Healthy thinking. So part of resilience is recognizing and correcting distorted thoughts. So two kinds of thoughts in particular to watch out for. One is called overgeneralizing. This is when you draw a conclusion based on just one or a few incidents. For example, you see a single unpleasant event as part of a never-ending pattern of defeat. So clue words to that, and I'll give you some examples, are right here. These extreme words like never, like when you get mad at someone and say, you never listen to me. Well, right, that's probably an overgeneralization. They probably do listen to you sometimes, but sometimes they don't. Or, you know, things always get messed up, or nothing ever works out, or everything is wrong. Nobody cares about anybody else, or everybody's just in it for themselves. When you use these words, never, always, you are overgeneralizing, and what you're doing is you are amping up your central nervous system. You're stressing yourself out. So you're in a stressful situation, and you start telling yourself these things, and it's highly unhelpful, and it's inaccurate. It is probably almost never true when you use one of those words, never, always, nothing, everybody, everything, you know, nothing ever works out. Well, sometimes things do work out, right? Nobody cares, really? Is that true? Maybe there are some people who care. So watch out for those thoughts. They tend to take a bad situation and then we stir up the pot, internally and make it worse. Another kind of thinking to watch out for is catastrophizing. That's exaggerating the importance of negative events and believing they're worse than they are, or that you can't cope with them. So you have a thought, one of our staff is going to get sick, then they're going to spread to the other staff. We're all going to get sick. There's going to be no one here to match the patients, or I'm going to be the only one standing and I'll have to work every shift. So those are catastrophizing thoughts that start with something that could happen. Sure, somebody could contract, the coronavirus on the staff, but then you're catastrophizing and taking it to an extreme. So you want to watch out for that. And basically, when you identify that you're doing catastrophizing or overgeneralizing, you want to ask yourself some disputing questions like, well, do I know for certain that, if it's nobody cares, do I know for certain that no one cares, or my manager never listens to me? What evidence do I have that my manager never listens to me? Well, they didn't listen to me today, but what evidence do I have the opposite it's true? Well, there are other times where she did listen. Is this response helping me right now? Is this productive thinking? Is it as bad as it seems? Or how do I know it'll happen? How do I know everyone's going to, get sick? And if it does happen, how would I handle it? So the idea is to recognize these thoughts that tend to make our stress worse and then correct them by asking these disputing questions. A couple other things we know about resilient people and thinking. One is they tend to accept what they can't change. A key to mental wellness and mental health is focusing on the things you can change. People who do better don't spend a lot of time thinking about stuff that's out of their control. They focus their energy and thoughts on the things they can control. Maintaining a sense of humor is critical in these times. Finding meaning and purpose in the work, so getting the broad view of what you're doing and why you're doing it. Adapting to the situation rather than bemoaning all the things that have changed. Why can't I work with my usual colleagues? Why can't just, figuring out how to adapt and maintaining a hopeful outlook. Now, that relates to our next, and I think second to last topic, which is positive emotions and experiences. I mentioned earlier that research on resilient veterans and resilient healthcare workers suggests that focusing on positive emotions is a key element of resilience. And I'm only going to talk about one right now, and that's gratitude. What is gratitude? It's got three elements. One, recognizing the good things in your life. Two, recognizing that those good things are due to something or someone outside of yourself. And third, being thankful for it. That's what gratitude is all about. And one technique I strongly advise during stressful times, and I will tell you, this is something I've been doing most of my adult life. I no longer write it down, but I do this mentally. I still do it every day. And that is, I keep a gratitude journal. I suggest you do write it down, but at least to start. But each night before going to bed or some other point in the day where you can be, where you will remember to do it, you write down three things for which you are grateful. And they can be the smallest little thing. When I see a green tree and I just notice it blooming and I just think, what a miracle that is, or the blue sky. Sometimes I turn on a light and I think it's amazing that, someone's working to have power generated all the time so that I just push a button and light comes on it, when it's dark. I know that might seem silly, but we take so much for granted. So it could be a small thing. It could just be a positive interaction. A colleague, someone smiles at you and it just feels good for that minute, a little connection with somebody. That's something you could be grateful for. A nice meal that you had. A simple gesture of kindness. Something you saw that made you laugh. In the worst days possible, when I go home after working 12 hours and I've had a lot of stress and I have a headache, I can still find three things to be grateful for. It's a discipline that can do wonders for you. And there is research on this. We randomly assign people to a gratitude journal group and people to do business as usual. And we measure things after 2 weeks and 2 months. And the people in the gratitude group actually show better overall well-being, physical and mental well-being. Okay, last topic for resilience before we wrap up and just do a couple final thoughts is social support. Social support is critical. It's sort of like the central element of resilient people is they have a support network. We know it buffers the effects of stress. Social disconnection is at least as harmful as physical inactivity, obesity, and smoking up to 15 cigarettes a day. This comes from years and years of validated research. So you want to identify who can provide support before, during, and after the pandemic response and how you're going to stay in touch with them, whatever your preferred modalities are. So take a minute right now on your resilience roadmap and just write down in those blank spaces, who are your social supports? Who are the people you can go to help pick you up, to listen to you, to support you and validate you. I'll stop for like 10 seconds. Just write down some people there in your roadmap. Okay. Last topic was healthy sleep, eating, and exercise habits. All I want to say about that is if you have trouble sleeping, you can try this app, CBTI. It's developed by the Department of Veterans Affairs based on our best evidence for treating sleep problems. There's a link here, and it's also on the roadmap so you can find it. So when should you seek help? Everything that I just described are great tools for building your resilience. And as I mentioned, most people will never need to seek professional help. They will get through this. You are already, by definition, resilient people. But these are some tools to increase that. But when do you need to look for help? When is it, when do you know when your resilience roadmap or your existing techniques aren't working? Number one, if you're having intrusions. So that's where traumatic or difficult material comes back into your consciousness against your will. So nightmares repeatedly, or flashbacks where you feel like you're back in a traumatic situation, or intrusive thoughts. You're going about your day and these thoughts keep interrupting you. So if you're having that for days on end or weeks, that's the time to seek help. If you're hyper aroused, so you can't settle down, you're anxious during the day, you're trouble sleeping at night, you're constantly irritable, little noises, you have this big startle response, you're sort of amped up and aroused continuously. If you find yourself avoiding reminders of a traumatic event, like you just won't go to work, you're calling sick, because you just don't want to be back there where something happened, that's the time to ask for help. If you're using substances to avoid and numb your feelings, and if in general you're feeling numb, spaced out, or like things aren't real. And finally, when your daily functioning is affected, when you find you cannot do the things that you normally would do, whether personal and family responsibilities or work responsibilities, then it's time to reach out for additional help. Where can you find help? We have our Peers in Need of Support program. If you email PINS, stands for Peers in Need of Support at Nebraska Med, you will be matched one-to-one. This is a peer. This is not therapy. This is not formal assessment, but someone to be a listening ear who can help guide you through. We have a virtual army of folks in our behavioral health surge plan that are prepared to help you: psychologists, social workers, psychiatric social workers, psychiatrists, staff chaplains. So just email that and we'll get somebody right to you. You can talk with your supervisor. The Federal Disaster Distress Helpline is available. They've got a phone number and a text and a website. It's a 24/7 number. You can just call and speak with somebody about what you're feeling, what you're experiencing, and they can help, again, like the PINS program, be a listening ear, direct you to some resources. And finally, our EAP provider, Arbor Family Counseling. This is the contact information listed there. Just want to go over 3 barriers that sometimes stop people from getting help when they need it. Number 1, stigma. Only weak or crazy people go to counseling. Remember, these are normal reactions to abnormal situations. If you're experiencing them, many other people are experiencing them also. And as we get deeper into this pandemic, it will become more stressful, and you may very well feel like you need help managing it, and there's absolutely nothing wrong. Again, normal reactions to abnormal situations. Another barrier, pride. This is my job. I signed up for this. I'm a nurse. I'm an APP. I can handle this. I've been trained. I shouldn't be having this reaction. I would suggest you remember that you are a human being, and human beings have these reactions. And finally, embarrassment. You may feel like if someone finds out you're getting help, that somebody will think that something is wrong with you. And here I would encourage you to remember that it takes courage to ask for help. And you may in fact serve as a role model for someone else who needs help and isn't reaching out. In summary, know your personal signs of stress. Be sensitive to those signs we talked about: physical, behavioral, cognitive, right? What happens to you when you're stressed? Think about what aspects of the response are likely to be most stressful. They may already be happening, but you can project ahead to what's going to stress you out the most. And by knowing your signs of stress, and by knowing what's going to be stressful for you, you can then think about what coping strategies you will use when those things happen. So hopefully you've marked them down. And consider learning some new skills. So practicing the deep breathing, the body scan, those are 2 that we just did. There's mindfulness, which is a wonderful skill and technique. It's a life habit you can learn, and visualization is 2 other examples. Those apps I suggested can teach you and walk you through those. Recognize and correct that distorted thinking. Remember that catastrophizing and the overgeneralization. Nothing works out. This is going to be terrible, right? When you find yourself, use those disputing questions. Focus on the positive emotions. Consider the idea of a gratitude journal. Identify who can provide support and how to stay in touch. That's that critical social support piece. Keep up good sleep, eating, and exercise habits. And lastly, know when to ask for help.